Hi, my name is Dr. Rajat Nan Ahmed, and I'm a consultant psychiatrist working in UK. And I'm doing a lecture series or interview series where I'm inviting some of the successful IMGs who are working in UK in different subspecialties to share their experience and inspire the next generation of IMGs. So with me is Dr. Zain Ul Abideen, who's IMG from Pakistan. He came into UK in 2017, and he's working in renal medicine. He's ST4 now, soon to be an ST5 in renal medicine. So I thought it'd be a good idea to ask him about the experience and learn from him as well how to get into renal medicine. So Zain, thank you very much for joining us today.
Thank you, Dr. Adnan. It's a pleasure to be here.
Um, can you tell us a little bit about your journey? So you told me you came here in 2017. So how did you come here and what have you been doing so far?
Yes, gladly. I came here in the 2017, and I basically came here on a pathway called the Medical Training Initiative, or the MTI. And before, just to I basically graduated from Pakistan. Graduated from Rawalpindi College in Rawalpindi. After that, did house job and my medical training in Pakistan, and then started working in nephrology. So I already had a background in nephrology or renal medicine, and the purpose of coming here on the MTI is basically to get more exposure to some components of nephrology which we don't often get exposed to back in Pakistan. So I trained, basically started the MTI. I worked on that for a year. It was a nephrology and general medicine post. And basically, during that year, I got interested in applying into a training post. I generally like the exposure that trainees get here in renal medicine. And my educational supervisor was actually quite supportive, and he said to me that, Zan, listen, I think you should start thinking about applying into a training post. And that's, I spent a year on the MTI. I basically started planning earlier. To fund my entry on MTI, I started to kind of plan to apply for ST3 recruitment. I went through all the application scoring and all of those little bits and bobs that you need in order to get shortlisted on the interview. And basically got support from my educational supervisor, also the other consultants who were in the department, and eventually applied and succeeded in getting a national training number. I opted for the southwest of England. That's where I started my MTI in Cornwall. And I just like living over here. I like the general ambience of the place. It's a very nice, calm, kind of isolated area where you don't really find a lot of IMGs, but I really had such a very good experience over here. My family was happy over here as well. So eventually what I did was I decided to kind of get the national training number and stay here in the south for my renal and general medicine training.
So when you mentioned the national training number, basically the ST training in renal medicine. So if somebody is thinking about that as an IMG, can you explain the process of that? How do you apply for that, and what is generally required to be successful in that?
Yes, of course. I think there are two words which I like to stress upon, and number one is planning. I think planning is really the most important thing with regards to gaining entry in specialty, not just renal medicine, but any specialty with that regard. And the second thing is to kind of show commitment to your specialty. And basically, what I recommend is that I think people who are doing IMT or CMT, or even if they're doing trust grade jobs, if you want to go into renal medicine, you need to start thinking about fulfilling all the criteria at least 12 months beforehand. And I would suggest go through the ST3 recruitment website. It's very clear, it's very elaborate, the things that they actually want. You've got 9 different things or 9 different aspects which you have to work on, and once you've actually done all of those 9 things, or most of those 9 things, you actually enhance chances of entry into an ST3 post. It basically all starts with general explanation of the rounds. You've got round 1 and round 2. Both of these rounds have become more and more competitive over the past few years. Before coming into this interview, I had a chat with my educational supervisor. He's been recruiting people into ST3 posts for over 10, 12 years now. Asked him this specific question about, what different aspects that you're looking for when you're recruiting people into ST3 posts. And you mentioned that the most important thing is commit to specialty, and secondly, we're actually looking for people who are safe, and we're also judging professionalism and during the interviews. If I go through the entire the application scoring and everything, we start off by things we've actually done in the past, like for example, if you've got a previous undergraduate degree, apart from your your medicine bachelor's, you've got BSc or BA, you get marks for that. If you've done a master's or a PhD or an MD in any discipline, that actually counts as well. Prizes and awards, if you've got any distinctions or any honors during your medical school, they count as well. You can go onto the ST3 recruitment website, and all of the things are clearly available on the site with the scoring as well. So if you look at these things 6 to 12 months advance, you can plan in advance, prepare the stuff. If you need any evidence like certificates or letters from home institution, then you can actually organize and kind of be ready. Then of course passing the MRCP exam is important, gets you marks. Even if you have passed all parts of the exam, it's fine, but of course if you pass the complete diploma, you get full marks. If not, then you'll get less marks. So basically these are all qualifications or those things that you've done in the past, which will actually help you get good marks and get shortlisted. Now, I would just like to elaborate over here that the commitment to specialty is assessed in the interview, but it's also assessed from all of these different achievements that you've had when you're applying for a post. When the rounds open, apply for recruitment, and the applications are made on Oriel. And what happens is you fill in a form, a very detailed form, where you're asked about various different things. The 4 that I mentioned previously. Then any presentations that you've given at local or international meetings, any publications that you've got, any teaching that you've done, QI, leadership, all of these things are detailed in that application form. And after that, what happens is that you get a shortlist score or initial score, after which you're basically called for an interview. Now, an important point to mention here is that if you look at the ST3 recruitment data for renal medicine over the past 3 to 4 years, the mean and median scores for shortlisting are between 30 and 35, right? So obviously that means that even if you have an undergraduate degree or a postgraduate degree, let's say if you've passed the MRCP as well, you will have to kind of some presentations or publications under your belt to actually raise your shortlisting score and actually get an interview call. The other thing that I would like to mention is that over the past 1 or 2 years, the competition ratios for renal medicine have been rising as well. The fill rate in March this year was 98%, and the competition ratio has actually gone up to 2.2. So just like any other acute specialty, this specialty is becoming more competitive as years go by. And when I asked my educational supervisor about, what do you see with regards to the future of renal medicine, he did say that we do see this specialty becoming even more competitive in years to come. So we want to do renal medicine. The first, of course, is to get a good list score so that you can get an interview call. And once you get the interview call, obviously, I would say 30 to 40% of your job is already done. Now, if shortlisted, then your interview will be basically, it's got 3 stations. The structure of the interview, it's got 3 stations. Three stations. Station 1, 2, and 3. Station 1 is all about your, your portfolio, right? So you'll have a panel of 3 interviewers who will actually go in through your evidence folder. All of the evidence that you've mentioned in your application, that will be kind of verified. You'll have to make 2 folders: eligibility folders and evidence folders. Eligibility folders will be about your GMC documentation, what position you have to be in the UK and work in the UK. The evidence folder is the one which will have all of these different 9 things that I've described in the application scoring. Now, advice to IMGs and all those applicants who are going for renal medicine, or for that matter, any other specialty, is to make sure that you organize your evidence folder very well, right? So it should be, there's detailed guidance on the S23 Recruit website, but there should be clear separators. Only attach things which are relevant, which are which actually present what you've claimed for in the initial application. I would strongly against over-claiming, because interviews are very strict. If you blatantly, like for example, over-claim something, that's that you might mark negatively, and of course, it doesn't look good on your part if you're over-claiming for something. So basically, station is all about evidence. Station 2 is about clinical scenarios. Renal medicine, generally these are emergency scenarios, like for example, hyperkalemia or AI. But there might be about other things, like example, during review I got a scenario from myeloma kidney. Now there's so many different scenarios which can pop up, and I think if you've done a renal rotation, that helps you. If you haven't done a renal rotation, then I would advise to go through some text where common nephrology emergencies are discussed. The Oxford Handbook of Nephrology is a very good book. It's very concise. It's not very big, and you can go through that before you enter to actually prepare yourself for Station 2. Station 3 is about Prophetism and Ethics, and I think for Station 3, the importance is, if you've given PACEs before, then you've actually gone through. Station 4 in PACEs is all about ethics, professionalism. You're presented with various different ethical dilemmas, which you kind of try and solve. If you've done PACEs, then I think Station 3 shouldn't be a big problem. If you haven't done PACEs, even if you've attempted it, that's fine. If you haven't done PACEs, then I would recommend you go through some ethical scenarios from PACEs books. For that, I recommend Rider Meter is an excellent book which kind of details 60 to 70 ethical scenarios that you go through, and that will actually help you in Station 3. Station 3, they sometimes ask about professionalism, and my honest recommendation for this is that, there's some books out there. I remember one which is called ISC Medical, that was recommended to me by one of my colleagues, and I really benefited from it. Some of the things which IMDs are usually weak at, like audits and QI methodology or governance, all of those things are explained in depth in that. So you don't have to study it from word to word or paper to paper, but it's important to go through topics like audits, QI methodology, governance, professionalism, all of these things will be tested in station 3. They carry marks, and I would strongly recommend you going through them as well. Now, sometimes in station 3, they will ask renal specific scenarios. Like, for example, in my interview, I was asked about a transplant recipient who, if I remember correctly, was rejecting for the second time. And they had problems with drug compliance, which had to be like identified. That was actually linked to his his psychiatric condition as well. Also, there was another scenario about somebody was being forced to actually donate a kidney, and that had to be identified. So these specific scenarios might actually pop up as well. But they're actually very simple, and I think that identifying them should be, a big problem, especially if you've renal rotation before. So it's 3 different stations, and after that, of course, once you're done with your interview, what happens is that your shortlisting score is combined with your interview score, and there's a ratio of about, I think, 20 to 80, where more weightage is actually given to the interview, and then you're given a final score, and that final score, is then graded, and whatever preferences you've given initially, you'll actually get a call. You'll get an offer about joining the ST3 program if your score is good enough for your preference. If not, then of course whatever preferences you've given, you get calls for those hospitals simultaneously. Commitment to specialty can be demonstrated by doing a remuneration. For example, if you've done in your IMT or CMT, if you've done a few months renal, that counts as commitment to specialty. If you've done a trust grade job after your CMT, after your foundation years, and you've done a renal job, again, that can count as commitment to specialty. But apart from that, you can actually show a commitment by showing posters at various conferences, like renal related posters, which could be case reports, or could be audits or QIs, could be original research projects as well. All of these things will actually count as a commitment to specialty. Let's say for some reason you can't publish renal, it's perfectly all right to publish stuff for specialties, but if you're publishing something renal, then during station 1, you can actually mention that I've been involved, I've done renal rotation, published stuff in renal medicine, which kind of shows that I'm committed to my specialty. A lot of the times, IMGs, especially in my institution, do ask me about where to publish, and it's a difficult question, but I think the advantage of being inside the UK, most of the institutions are actually subscribed to BMJ journals, and one of them is BMJ case reports. So if you're completely new to research, then you can write a case report. If you find a case interesting, discuss it with your education supervisor or the consultant you've seen the patient with. And of course, they will tell you to actually write the case up, and you can publish them in journals like BMJ case reports. There's indexed. You can also PubMed them. The reason I say PubMed index because when you're applying for ST3 recruitment in the application scoring part, they only accept papers which are in PubMed index journals. I think you get 2 marks if you've published something which is not PubMed index, but a lot of weightage is actually given to journals, to papers which are published in PubMed index journals. As far as showing posters is concerned, there are many conferences which take place in the UK, and I think one of those conferences is medicine, organized by the RCP every year. I think that's an excellent platform for doctors, especially IMGs who are new to the NHS and targeting training posts, to present their work. Obviously, the work has to be novel. If not novel, then it could be generating some sort of if not evidence, then it should be generating some sort of message for the audience. I think that's a good confidence target if you want to show posters at a national meeting. You can also present at local meetings. So local meetings could be like, for example, within your deanery or even within your hospital. You can present an audit or a QI over them, and of course you can kind of claim marks for that when you're applying for for ST3 recruitment. Then of course teaching is important. Again, if you do renal related teaching, that counts. You can actually demonstrate that this is, your commitment to specialty. You like doing renal, and that's why you've done some renal teaching. What I did was, initially when I started as an MTI registrar, I went to the postgrad center. I designed a series of lectures, about 4 to 6 lectures, 6 months for F1s. I used to teach F2s, and after I used to repeat the cycle all over again. And that is basically that. Again, those commitment to specialty. Also, the tick box is ticked. You get some good formal feedback from the graduate center, and it just helps. You gather really good quality evidence that you can show in your interview. So I think that's really important for for people who are targeting ST3 recruitment posts in renal medicine. Audits and QIs are very important. For some reason, back in our home countries, audits and QIs are, they're not a standard part of the curriculum. When we come over here, I think audits and QIs are important for patient safety, for governance, many other things. So I would recommend all of the IMGs or targeting training posts to actually get involved in auditing activities. Again, every department has a governance lead. Go to the governance lead, or you can talk to your educational supervisor, who will actually give you some audit topics to work on. Let's say if you're having difficulty finding an audit topic, there are many websites which you can access. BMJ Quality Improvement, it's actually a journal, BMJ Quality and Safety, where you can just go onto the search bar, type renal medicine, and you'll have lots of audit topics that people have already worked on, and you can implement those audits in your, you can actually work on those audits in your clinical setting as well. Similarly, you can, there are national audits going on AI, which involves, lots of, it's all over all the UK, and you have to actually compute data every month or every 2 months. You can actually enroll in those audits and by getting in touch with your educational supervisor. Of course, that counts. I'm not sure if you'll be able to claim a lot of marks for your audits, but it's a good step. It's a good stepping stone for later on designing your own audit and your own quality improvement projects. I'd like to mention here that quality improvement projects carry much more weightage than audits, and you have to complete the technical, to call a QI project complete, and that definitely carries more weightage than an audit. In a nutshell, these are the various different things that you can work on, and improve your CV, improve your portfolio, and then for ST3 recruitment. Yeah.
That's great. I think thank you very much for sharing your experience and sharing all the pointers. I'm sure a lot of people thinking about renal medicine will get a lot of guidance from all of this stuff you've shared. Is there anything general about IMGs you want to share that, if they are working in, they may be junior IMGs just starting and exploring different specialties, how can they maximize their chances of getting whatever they're doing or improving themselves in UK as a foreign doctor?
Okay. I think for starters, I think just take it easy. The first 2 to 3 months in the NHS are always difficult because you're actually migrating from a completely different health system into the NHS. And anxiety, apprehension, is very common, and it virtually happens to everyone who joins the NHS initially. So first of all, my advice for all IMGs would be to not to get disheartened, or not to get upset if the first 1 or 2 months don't go all right. The most important thing is to stay in touch with your educational supervisor, your clinical supervisor. Make sure when you start, you shadow someone, whether it's as an SHO, or a foundation doctor, or even as a registrar. When I started as a registrar, and the first 2 months were incredibly difficult because I was on the registrar rota initially, as soon as I started in the NHS. And obviously, I don't think it's a lack of knowledge that's the problem. The problem really is a lack of understanding of the system, and that takes time to get used to. So I would say shadow someone, your fellow SHO who's been working here for a while, fellow registrar. Shadow them for 4 to 6 weeks, and then see where you are. Have a meeting with your educational supervisor, and it's from there onwards that you should start working independently. I would also suggest that when you start as a doctor over here, have a clear goal in your mind. I've seen a lot of people actually who've started as trust grade registrars, and it's been 8 or 10 years and they're still trust grade registrars. And the reason for that is that they don't plan in advance. If you want to do, for example, if you want to do renal medicine, and you've identified that I want to do renal medicine for a future, then start planning early, gather all the evidence early, so that when you're for recruitment, you get a call immediately, and then after that you just have to do well in the interview, and you'll get the post eventually. So that would be my couple of things I would mention to the IMGs when they're starting in the NHS. Yes.
Yeah, thank you for sharing your experience and all the tips. I'm sure a lot of people will get benefit from this. And if somebody wants to contact you in terms of helping getting their application for renal medicine, would that be all right for them to contact you?
Yes, I'm very happy to help out. In fact, I have people from my parent institution, and from other institutions have been in touch with me. I have guided to how to make ST3 applications, and prepare for interviews. And I've guided some people about the MTI as well, which seems to be a more common pathway for IMG recruitment now in the UK. So I'm very happy to help anyone who wants to pursue renal medicine as a career. I personally think it's a competitive acute specialty. The workload obviously is it's a busy specialty, but it's got its pros and cons. It can be very rewarding at times. You can either plan to be a general nephrologist by completing your CCT, or you can branch out. You can subspecialize in things like transplant, or PD, or hemodialysis, or even some people go on to do some of the rare stuffs like vasculitis and glomerulitis. You can actually deviate to procedures as your specialty. A lot of nephrologists and proceduralists like doing kidney biopsies or putting in non-tunnel and tunnel dialysis catheters, BD catheters. And as time progresses, I think the need for more and more nephrologists will increase. And basically, how nephrology operates is like a hub and spoke pattern. That you've got lots of nephrologists in a tertiary care setting, which deliver care to all of the peripheral centers. So with time, I think there'll be more competition. Applications will have to be prepared better, and I think it's an exciting specialty to work in. If I can help anyone in any way, I'm very happy to help out.
Thank you very much for your time.
My pleasure. Thank you very much for your time.